This is a 4-chamber view which is not included in the RVOT criteria, but we can see the regional wall motion abnormality. So RV as a whole is dilated, and you can see the chamber volume is more than that of the LV. The RA also is dilated. This is the parasternal long axis view. RV infundibulum or outflow tract dilated more than 32 millimeter. In short axis view, dilated more than 36 millimeter. So it is satisfying the criteria. 1 should be present. So fractional area change of RV, which is a quantitative measurement by echo, can see during diastole to systole how much it changes, 28%. So fractional area change less than 33% is a major criteria. Here the dilation is persisting even after the systole. So the fractional area change is significantly reduced, 5.2%. So this is also satisfying the major criteria. So this is MRI indexed right ventricular end diastolic volume less than 110 in males or less than 100 per meter squared in females. So it is a grossly dilated. You can see the free wall thinning here. Free wall of the right ventricle is there. There is a triangle of dysplasia from the infundibulum, apex and the inferior or the posterior wall. So this is the epicardial or free wall thinning. So LV looks normal. There is pairing of the interventricular septum. This picture of MRI is to show the difference between the sarcoidosis and the ARVC. So in this picture there is involvement of the interventricular septum as well as the RV free wall. There is a late gadolinium enhancement. You can see there is scarring of both the septum and the RV free wall, which is in the typical area of triangle of dysplasia. But in ARVC the interventricular septum is paired. So there is only LGE, late gadolinium enhancement, indicating scar in the RV free wall. There is thinning also. So, and there is a dilated RV and the RA. So, this is classical of ARVC, while this is a sarcoidosis imaging picture. These are all from patients of ARVC taken from an illustrative review article. Here we can see the RV is grossly dilated. There is bulging of the free wall also. This is in the apex. The free wall in the here is thinned as well as there is fibrofatty replacement. Here also LV wall also is thinned. When compared to the anterior wall, the lateral wall is bit thinned. Here we can see the bulging or the change in the nature of the free wall in the RV here also. Here we can see in this long axis view showing the bulging of the RV in the infundibulum. So, outbulging or pouching of the RV, which can either be dyskinetic or aneurysmal with or without thrombus, and here there is a free wall thinning. You can see the free wall is thin here. This is the other view, short axis view, similar to the echo short axis view. There is bulging of the RV free wall. So, this is very typical major criteria. So, all other changes, this is also a short axis view. So, LV looks almost normal in the anterior and the septal portion, while the inferior and the lateral portion shows thinning. And here also there is thinning of the RV free wall with the bulging outside, outpouching. So this is the late gadolinium enhancement showing scar in the RV free wall, RV dilatation and the same RV involvement here. Right ventriculogram, we can see the outpouching, that is a thinned wall, there is loss of myocytes, so there is outpouching because there is only fibrous and fatty tissue. And there is a inferior wall involvement also here, there is outbulging and thinning of the RV wall. This is the newer addition to the multimodality CT, newer addition to the multiple imaging strategies we have to diagnose ARVC. We can see the green one, there is only one measurement of the RV because the free wall is already thin by only 5 millimeter, while the LV is thicker. So we have the red one which is the endocardial and the green one which is the epicardial measurement of the LV volume. So you can see the volume of the RV is increased, it is grossly dilated, and involvement of the lateral wall with the outpouching, and we can clearly see the fibrofatty infiltration of the RV free wall. Here there is a outpouching or aneurysm.